Hello everyone. My name is Amanda and I'm from the Association of Singapore Marine Industries and I'll be your MC for today. I'd like to take this opportunity to welcome everyone to our webinar today, a joint webinar between SME and the Economic Development Board on the briefing on the updates of the latest safe management measures and pre-departure preparatory program to the marine and offshore sector. First, we will just run through some simple admin matters. We'll have the EDB team to actually share a bit more about the updates, and then after that, we'll move straight into the Q&A section. So we'll just get everyone to go ahead and scan the QR code, or my colleague will actually send a link in the chat box. So basically, should you have any questions at any point of time during the webinar, feel free to drop your questions on the Slido platform, which the link will actually lead you to, and we'll try to answer them during the Q&A session. Okay, without further ado, I would like to invite the EDB team. I think first up we have Mr. Gavin Tan to share a bit more. Gavin, please.
Hi, morning everyone. This is Gavin from the Economic Development Board. And I will just be quickly taking you through a couple of slides just to highlight the various entry approval or entry mechanisms for CMP workers. So maybe I'll get straight into it. And then I've only got a couple of slides. And once I've shared the slides, then we'll be happy to take any questions or clarifications that you might have.
Yep, sorry, Gavin, just to quickly jump in, maybe you can click on the presentation mode.
Give me a sec. Can you still see the window?
Yep. Oh, good.
Okay, great. Okay, so essentially, there are really now two entry routes for vaccinated COVID negative CMP workers, the pre-departure preparatory program route, as well as the work pass holder general lane. So maybe just to orientate you to this slide, on the top you have your pass types. So if you are a work permit holder from India, Bangladesh, or Myanmar, and then are a new IPA holder who is COVID negative, and by COVID negative we mean you're either COVID naive, have previously had COVID but recovered beyond 90 days, and also previously had COVID but recovered in the last 7 to 90 days, then the proposed and suggested entry route is through the pre-departure preparatory program. And just one caveat here is that if you join the pre-departure preparatory program, if your worker joins, and subsequently, as part of that program, he has to go through a PCR or a professionally administered ART test. If he comes up as C positive during that test, then of course he will need to drop out from the PDPP program, because naturally then he is no longer C negative. But once he is recovered, then he can actually come in again through this program, through the PDPP program. And when he comes in the second time, he will not need to actually serve the 2-day SHN for the PDPP. He can just join the flight with the rest of his PDPP batch and then travel to Singapore. So that's the first archetype of workers. The second is about work permit holders from India, Bangladesh, and Myanmar, but are returning workers, so they're not new IPA holders. So the suggestion here is that these workers should come in through the work pass holder general lane. So that's the second archetype. The third is your work pass holders, your work permit holders, sorry, from all other sources. And this includes both your new IPA holders as well as your returning workers. And the suggestion is for them to also come in through the work pass holder general lane. Lastly, you have your S-Pass and your EP holders from all sources, be it India, Bangladesh, Myanmar, or otherwise, and they can all come in through the work pass holder general lane as well. So this is just a broad orientation in terms of how your CMP workers can, and the recommendation in terms of how they should be coming into Singapore. So now I'll elaborate a little bit more on the pre-departure preparatory program. And compared to its counterpart, which was the tightened end-to-end process, the intent of the PDPP is really to, number one, lower the cost of bringing in workers, as well as shorten the time taken to bring in workers. And in doing so, we hope that this can help bring in more workers from the CMP sector and ease some of your manpower challenges that you may have been facing due to COVID over the last 2 years or so. The PDPP is something that we started from mid-March, and as I mentioned earlier, in terms of eligibility, it is for work permit holders with new IPAs from India, Bangladesh, and Myanmar. So for the SHM protocol, the first thing is that as part of the PDPP program, they will have to do a 2-day source country SHN, and subsequently they will need to do, they will travel to Singapore and they will do a 3-day onboarding in Singapore. And I go as far as to say that this is not so much of an SHN, but it's really just the onboarding program that all new IPA holders have to go through when they come into Singapore, be it through the PDPP or be it through the Work Pass general lane. Of course, excluding those coming in from Malaysia. So there are aspects of things like verifying vaccination certificates and on-arrival test and things like that, but the program is very much really your onboarding program. Within the source country SHN, the 2-day SHN, we've also streamlined the protocols and the locations in which you can undertake these programs. So we've informed the providers that the facility requirements are now pegged to the onboarding center requirements, and we also have increased the cohorting arrangements to allow for an increase in the number of workers in the same room. Should of course the provider be interested to take up this option. Then of course you have the health status for workers coming in under the PDPP program. So compared to the previous regime where serology was an option, serology was a requirement, sorry. Serology is now optional. And the testing regime is either a PCR test or a professionally administered ART test. And then you have your broader border protocol measures and aligning to that. So having things like the workers who come in need to be fully vaccinated with WHO EUL approved vaccines. And this will be verified through vaccination certificates and subsequently also verified upon arrival in Singapore. They will have to go through the vaccination serology at the onboarding center. And also just to note that their final dose of the vaccination needs to be taken at least 14 days before they arrive in Singapore. And as I mentioned earlier, then if you test COVID positive at the first upon entry of the PDPP program, then you'll need to rejoin. But you'll need to drop out first, and you can subsequently rejoin, provided you are coming in after 7 days from testing COVID positive. Also worthwhile noting that if you do have that cohorting arrangement, that if one individual in the room tests C+, essentially all people sharing the room will need to drop out and can only rejoin subsequently. Also, last point on this slide is that we do have a mechanism to actually impose penalties for workers who claim to have completed the PDPP program, but subsequently when we do our checks and our inspections, we find that they have not actually gone through the program. So this next slide is really then just an abridged version of the general PDPP process flow. And I would caveat that for the full details of what the flow looks like, I would suggest that you approach the provider or ask me in this case to get the full end-to-end details. But maybe just to walk you through the entire process to give you a sense of what this entails. So you have step one, where basically the employer, so yourselves, will need to engage the PDPP provider to explore the possibility of bringing in workers. And essentially what this means is because our PDPP providers don't necessarily run flights every day. They don't run the program every day because there are capacity constraints and things like that. So you'll need to engage them to find out when is the most opportune time to bring in these workers. So then that comes to step two, where the PDPP then can provide confirmation of the slots availability, and then you can subsequently make payment and start submitting the supporting documents to the provider. So things like your vaccination certificate for your workers, the work permit details, the IPA, things like that. Subsequently then, the PDP provider will actually collate some of these details and submit the details of the workers to MOM to tag them that they are coming in under this PDPP process. And then once that is done, the PDPP provider will actually receive a confirmation from MOM and will subsequently then reach out to you guys to start applying for entry approval through the MOM portal. And maybe just to highlight here, for steps 1 to 5, the intent is actually to complete this maybe 1 to 2 weeks before the worker actually checks in, to cater for sufficient lead time should there be any errors in the submission or any delays or anything like that, just so that there's a little bit of buffer. And this is important because once the worker checks into the facility at the source country, there's really only 48 hours or so before they fly off to Singapore. So it's very important that these things are done upfront and before the worker even checks in. So moving on to step 6 is basically then the worker will check into the facility and they will take that PCR or professionally administered ART test. And then the PDPP provider will subsequently submit the details to EDB or the economic agency who oversees them. So it could be EDB, it could be Enterprise Singapore, it could be BCA. And this is then also just so that we are aware of the people who are coming in through the program. Then moving on to step 7 is basically if the worker is C minus, then he can board the flight upon completion of the program. If he is C plus, then he needs to be dropped from the program. In terms of step 8, that's really then once the worker has completed the program, he checks out and he's transported to the airport to board the plane, the flight to Singapore. Again, we are quite stringent about this. We need to make sure that the worker, in between completing the PDPP program, he should be transported straight to the airport. Can't really do any pit stops or can't really wander around because that will kind of break the integrity of the entire flow. Then moving on to step 9, the worker then arrives in Singapore and is transported to the onboarding center through the meet and greet agent. And this meet and greet agent is someone either the provider, the PDPP provider, or the employer will need to liaise with to actually arrange for the pickup. And then you have steps 10 and 11 where the worker goes through that onboarding program, and then subsequently, when he completes the program, he can commence work at the work site. So now moving on to the last slide about work pass holder general lane, and a lot of this information is probably already available on MOM's website. But essentially for the work pass holder general lane, as I mentioned earlier, the eligibility is for number 1, all S pass and EP holders, returning workers from all sources, as well as work permit holders with new IPAs, excluding those from India, Bangladesh, and Myanmar. So the SHM protocol for these is aligned to the border control protocol. So currently based on the measures, there's no real source country SHM required. But work permit holders with new IPAs, excluding those from Malaysia, will still need to complete that same 3-day onboarding program that the workers in the PDPP program also need to complete. The entry protocols are subject to the prevailing border protocol measures. So what that means, currently the latest update is that from 1st April, there is no entry approval requirement for them. So there's no need to go onto the MOM system and apply for entry approval. And the health status is very much similar to the prevailing border protocols as well. So testing regime is either your PCR or professionally administered ART. And then similarly to the PDPP program, they need to be vaccinated with WHO EUL approved vaccinations, and it needs to be a minimum of 14 days since their final dose before they arrive in Singapore. So this is the last slide. I'll pause here to see if there are any questions or clarifications on the CMP entry flow. If not, then I can hand over to our other team in EDB to share a bit more on some of the safe management measures and the updates to that.
I think, Gavin Wilson, I'm stepping in a bit. We'll do the Q&A at the end. So
okay, sure.
Yep.
Okay, then maybe I hand over to Wei Shin. I think he has set up his laptop and has the slides, so he can just share from there.
Yeah, thanks, Kevin, and good morning, everyone. I'm Wei Shin. So I'll be sharing with everyone on the updated SMM measures. So let me open up a presentation.
While Wei Xin is setting up the slides, anyway, this is Kun Wei here from EDB. Just like to maybe bring certain key points with regards to the updating of the SMM. What we have done, EDB has done for the marine and process sectors is to align almost all the safe management measures for M&P sectors with the MOM's requirements at the workplace, or SMM requirements at workplace. So later on, when Wei Xin is sharing with you on the updated SMM, you will find that the marine sector specific SMM is largely left with only 3 items in the document. One will be the mandatory precautionary measures for contact operations, the contactless operations, and management of C+, AG+, NTL crew, not to land crew detected on board ships in EDB managed shipyards and process terminals. So that's something that is still retained as sector specific because that is managed under Port Health and MPA. While the rest of the SMM, we have mostly aligned, as mentioned earlier, to the MOM's requirements at the workplace. So with that, I will just let Wei Xin bring us through, and he will be explicit. He will try to be explicit what is mandatory and then what is best practice and is encouraged to incorporate in your own system of SMM and your business continuity plan. Okay, all right. Thanks, Wei Xin.
Yep. Thanks, Kun Wei. Okay, so what you are seeing on the screen right now is the SMM, the requirements for SMM on the MOM website, and this has been updated on the 29th of March 2022. I'll probably zoom into some of the key points for everyone. The first point is vaccination. So point number 6, vaccination status, and only fully vaccinated workers or employees can actually enter the work site. And also for point number 6A, part 2, those who are certified by MOH to be also medically ineligible for COVID-19 vaccination may also continue to enter the workplace. The next one is point number 7. Up to 75% of employees who are able to work from home can be at the workplace at any point in time. Okay, another mandatory one is point number 8 on the wearing of mask when indoors, and in the mask off settings, there must be a 1 meter distance between each group of up to 10 persons. Okay, employees can also organize events, including social events such as corporate dinner and dance. And what we have just discussed is all in line with the SMM 1 to 5, which I will share with everyone later of the overview. Other parts of the SMM on the website itself, that includes the use of trace together only safe entry, or any other measures to record the entry of personnel entering the workplace. The cleaning of common spaces and touch points are also included. So these areas need to be cleaned regularly in accordance with NEA's advisory, and also on the ventilation in the workplace itself. And for part C, what to do when the workers are infected, workers should inform their employers if they are unwell or tested positive for COVID-19. And point number 15, steps to be taken by the employers. Importantly is steps 15A, establish if the colleagues had interacted with the infected worker recently. B, conduct ART on colleagues who have interacted with the infected workers and follow the healthcare protocols. And C, clean the area where the infected worker was working in accordance with the NEA's advisory. The cleaning of the premises is not required. And part D is to review the implementation of the safe management measures. What is important to take note is also the employers have to continue to implement a system or maintain a system of safe management measures. And this has to include a detailed monitoring plan to communicate and explain the measures, and to put up signs to remind employees and visitors, and to also engage the unions on any of these arrangements. The appointment of SMOs is to continue, and the SMOs roles is to coordinate the implementation of the SMM, to conduct inspections and checks to ensure compliance, assist the employer to rectify the non-compliance, and to keep records of inspections, checks, and correction actions. So in part E, it lists the requirements that have been lifted from A to H, but we will still we do encourage companies to still have these, especially parts A to C, to be included in your business continuity plan, to maintain it. Okay, I will next share another presentation. Okay, so this is the sector-specific SMM that we have shared since 15th of March. So these are the key points in our sector-specific SMMs. Point 1, all M&O companies are required to adhere to the MOM's requirements for safe management measures at the workplace, as what we have seen in my previous presentation. In addition, the marine and offshore companies are to adhere to the following sector-specific SMMs, which are the MPM, the contactless operations, and the C+ and AG+ incident management involving the NTR crew in this document. So this document covers 3 key areas, which focuses mainly on the vessel operations. For point 3, records and documents are required under the Workplace Safety and Health COVID-19 Safe Workplace Regulations 2021. So these are some of the examples that when we go down for inspections, we will request for these records. Point A, personnel entry records that includes the vaccination status, inspection of mask wearing, compliance when indoors, inspection of safe distance during the mask off settings, and adherence to the prevailing permitted group size, and also the permitted percentage of the workforce on site, which right now is 75%. And also the correction actions from SMOs, regular inspections and checks. So this is in line with the previous presentation, which is also listed on the MOM's website. Site occupiers and premises owners can, at their own discretion, stipulate additional SMM for their workers, contractors, or visitors to adhere to. And companies are encouraged to incorporate the best practice SMM to reduce worksite transmission in their system of SMM and their business continuity plan. And this is to minimize business disruption should the situation worsens. And a BCP best practice guide for the marine and offshore sectors companies will be published in the MTI or COVID Go-based websites when it is available. And these, the practices stated in the BCP best practice guide, for example, the COVID-19 incident response management plan, are not mandatory. So later I'll be going through the COVID-19 incident response management plan. And companies are encouraged to review and incorporate the appropriate best practices in their system of SMM and or their business continuity plan that will reduce worksite transmission risk at their own discretion and resources. So in this document itself, as what we have shared, is that there are 3 key areas mainly focused on the mandatory precautionary measures for contact operations, the contactless operations procedures, as well as also the management of C+ and AG+ not to land crew on board vessels. Okay, so these documents can be found on our goal-based website. So I will not go into details for these documents. Okay, so this is the incident response and management protocol. And on 24th of March, Singapore is to ease the community SMMs as announced by MTF. And from 29th of March 2022, the community SMMs will be eased. And this is in line with the 5 core parameters, which we have seen, which is on group sizes. The current posture is 10. On the mask wearing, which is required indoors and optional outdoors. The workplace requirements is 75% of those who can work from home may return to the office, and the maintenance of safe distancing of 1 meters during mask off settings between individuals or groups. And also the last one on capacity limits of 75% for large settings and event sizes of more than 1,000 pax where there is no 1 meter safe distancing. And premises operators or event organizers is to avoid any choke points and spread crowds. This is to prevent any congestions in the areas. Okay, this is the talking about the protocol 123, which is in line with the covid.gov.sg. So this is the latest healthcare protocol. So do check on this website for the latest healthcare protocols. And the protocols are for protocol 1 is for individuals who are feeling unwell. For protocol 2 is for individuals who are well and tested positive or have been assessed by a doctor to have a mild condition. And for protocol 3 is a close contact to any C plus cases. Okay. Companies are strongly encouraged to incorporate this SMM as best practices. That includes this COVID-19 incident response and management protocol to minimize any disruption to the operations in the event of an outbreak. For the C plus and AG plus management for the shipyards with vessels under quarantine, that is under quarantine by the Port Health and the Maritime Port Authority of Singapore, they have to adhere to the requirements which has been issued by PHS and MPA. So what I'll be going through is the latest AG plus and C plus IRMP, or the Incident Response and Management Plan. Okay, what do you do when you have a C plus or AG plus that's detected at the work site? So within the first 6 hours, do isolate the AG plus or C plus and the close contacts and convey them back to the accommodation and adhere to protocol 1 or 2. For any AG plus or C plus, the company is strongly encouraged to cordon off and clean the affected work zones as part of the housekeeping or cleaning regime before restarting work. It's important to note that do inform EDB of any large clusters of C plus or AG plus cases at your workplace, which I will share with everyone what's the definition of this large cluster. Within the 24 hours, companies is to maintain and provide the following information upon request, which is nominal role of the AG plus and C plus and the close contacts, map out the locations where this AG plus and C plus had worked in the site. That includes the site layout and also the cleaning records of the affected work zones. And any workers issued with the health risk notice is to adhere to protocol 3 and identify close contacts by companies but are not issued with the health risk notice may consider undergoing protocol 3 or alternatively doing a test day 1, day 3 and day 5 ART and under the company's own discretion and resources. EDB will assess the transmission risk level based on the risk assessment matrix, which I'll share with everyone later as well. And for high risk is classed as high and above. EDB may issue a stop work order under the Infectious Diseases Act at the affected work zones or work sites if companies are unresponsive to reduce any transmission risk. And over the next 30 days, companies to map out all the AG plus and C plus detected over the rolling past 3 consecutive days to determine if there's any worksite transmission. Follow-up worksite inspections on the SMM may be conducted by EDB for large clusters incidents to determine if there's any worksite transmission, and for any repeated non-compliance or breaches to the SMM under the Workplace Safety and Health COVID-19 Safe Workplace Regulations 2021, enforcement actions, for example, composition fines or stop work orders may be taken against the workers and or the companies. So what is the large clusters? Okay, large clusters are defined as 20 or more C plus or 40 or more AG plus cases detected over 3 consecutive days. And this is also covered in our risk assessment matrix. And this also includes 5 or more work zones that has been detected with C plus or AG plus cases. So point number 2, for all C plus and AG plus cases, please ensure the following information are made available upon request, which is the contact details of the C plus cases and the worksite, the details of the close contacts, the worksite layouts and affected work zones, as well as the cleaning records. So this is the recommended compliance reports templates, and we still companies can continue to use these existing compliance report templates as a best practice for their own COVID-19 incident management and records keeping. So this is an example of what we meant by a worksite layout that will actually depicts the AG plus or C plus cases detected. Okay, so what we want to actually what the companies can do having this is to help them to map out and that have a visual over where are the affected areas. Okay, this is the COVID risk assessment matrix, which actually has details. So this remains unchanged from the previous version. So what we have changed that is covered in the blue color. So as what I've shared is 40 or more AG plus and 20 or more C plus cases over 3 consecutive days under the high and very high risk areas risk classification. Okay, if not, that's the last slide, and yeah, we open the floor for any questions.
Yeah, thank you so much. So next up, sorry, we'll move into the Q&A session. For this session, actually, I would like to invite SME's Executive Director, Mr. Wilson Ang, who will actually be the moderator for this session. Wilson, please.
Hey, hello. Hi, guys. Right, thank you so much for sharing, EDB colleagues, and also everyone for dialing in. So I'm just mindful, quite a few questions came up, and again, I'm very grateful EDB colleagues actually trying to answer them. So I'm going to just look at some of the questions that popped up. So we have 2 segments, essentially, just a quick recap to everyone. One part you have it's where the PDPP is, and the other aspect is the SMM. Both are equally important. So I'm looking at a question because I'm not sure if you guys have seen it, but we will direct focus now on the Q&A, the Slido itself, just to go through the questions first. Then anything else, we'll just come back to see at the chat screen. So any of the audience, you'd like to ask any question, check out the Slido, click on it, and you can ask the questions there, and then we'll try to answer from there. All right, so going straight away there into the Slido, I have a few questions and a few keeps changing. So I'll just go top to down because it seems like there's already 16 questions. So to begin with, there was one question is on PDPP. I think the first we are focused on that is there a need for entry approval by MOM for Malaysian workers staying in the dormitory?
Yeah, Wilson, this is Sean here from PDB.
Yeah.
I'll maybe make a few points about the PDPP and also the
Yes,
SMM process, and
Yes,
then we can take the questions from our counterparts one by one.
Can-
But at the same time, can I trouble the Secretariat to sort of display the Slido, or at least the QR code, because I lost it.
No problem. We'll just
Is it
cut and paste the
possible?
link again. You look at the chat
Yeah.
screen, is there?
Okay, fantastic. Now I'll look at that later. But maybe just for everyone's background and context, there are a couple of points that are underlying what we have just shared from EDB, which was done in consultation with MOM and our other government agency counterparts. The first point is that the situation, thankfully for COVID, is improving and easing, and the latest round of measures are a step in the right direction. And so EDB has been trying to help the marine industry as far as possible to see how we can address some of the earlier pain points, in particular, a lot of the costs associated with the SMMs and the PDPP. So the situation is improving. But the second point is that we're not yet out of the woods. And that's why there are still some protocols in place, both from the PDPP and as well as the SMM point that we really appreciate your help to work with us on. Specific to the PDPP, there is a view that we are likely to try to make the PDPP a sustainable arrangement going forward. And the reason for this is important because our experience on COVID has taught us that we need a certain resilience, a greater resilience in some of the lanes that bring in the largest numbers of foreign workers. And this is specific to Bangladesh, India, and to a smaller extent, Myanmar. And the message here is that we're trying to balance two things. One, we want to make it as cost efficient for you to bring in your workers, which is why you'll notice that for the PDPP, we only look at more of a higher risk subset of workers. So returning workers, that means workers that worked here before. That means not the IPA workers. Actually don't need to go through PDPP, right? They can come in. And that's because we're trying to balance between the need to maintain a sustainable, resilient channel with the need to ensure that we don't impose unnecessary costs on you. And that's really how we are trying to balance between these two aims with the expectation that the PDPP is here to stay for the long term. So with that as the context, and the reason why we are trying to do these things, either for the PDPP as well as for the SMMs, maybe we can go through the questions, Wilson. I suggest we take all the PDPP questions first.
Sure.
So that we can close off that discussion. If Kung Wei and colleagues are also okay, because I also have to run for another discussion.
Okay.
At about 11:20, 11:30. And then maybe we'll put the questions together and I can invite my colleague Gavin to take us through most of the questions
All right.
answers. Yeah, sounds good?
Sounds good. Kume, you're
Next one.
fine, right?
Yep, I'm good.
So we start with the PDPP side, or you want to? Sorry, Kume, you want to add a few words?
No,
first?
no, I'm fine. I'm fine with going through the PDPP side first because that's because Sean and Gavin is still around, right? So maybe just clarify all these. Then after which then we can move into SMM parts.
Okay. Actually, SMM has quite a few questions as well. Okay. So
Yep.
going to the PDPP itself, I think one of the questions that I thought was quite interesting is, firstly, current work pass holders, if they are deployed overseas for work, can they come through the work pass general lane? And would the new S pass holder that stay in the dorm come through the work pass general lane?
Yeah, thanks, Wilson. So the general rule of thumb, right, is if they are returning workers, they can come in through the work pass holder general lane. So assuming that those people are posted overseas are returning workers, right, then they can simply come in through the work pass holder general lane.
Okay. So it doesn't. So S pass, even though they stay in a dorm, by default is they don't really need to go through the PDPP. They can just come in straight.
That's right. All S pass and EP holders can just come in through the work pass holder general lane.
So maybe just to add on, that means to say actually because there was a transition period from 13th of March to the last day of April. Actually now as it is, they don't need to come through the WPG, the general lane, right? Because they get entered without entry approval to begin with.
Yes.
Yeah, thank you. Then there's this other question I came and asked about. If worker is vaccinated but the vaccine is not in the WHO list, is there any other way for them to bring in the workers?
As of today, they need to be vaccinated by WHO approved vaccines. And the second caveat is that it needs to be 14 days since their final dose. So if it is not a WHO approved vaccination, unfortunately, they won't be allowed to enter into Singapore.
So the stand is quite clear.
Yeah.
Okay. There's this thing about someone asking when joining the flight after the person have recovered, will it will be the next batch of flight, is it? So the question is very broad. So I'm just trying to understand what the person is trying to ask. So if a person has been got COVID and then when they recover, they can just join any next flight. Do they still need to go through the PDPP?
So if the person tested C plus during the PDPP, then that worker can simply join the flight as long as it is at least 7 days later from when he tested C plus. So there is a underlying border control protocol which says recovered workers who tested C plus within 7 to 90 days can enter Singapore. So that 7-day minimum requirement is also applicable to a C plus worker coming in through the PDPP program. If the worker is recovered but had COVID before the PDPP program or never came through the PDPP program, then he will still need to go through the PDPP program in its entirety.
Entirety, right?
Yeah.
How about this case where I saw someone that texted me as well saying that what if a worker used to work in Singapore, left the country, and then come back again but under a different company and had to apply the IPA, can they be considered as a return worker?
It would be a new IPA, is it?
It should be under a new IPA, right? Just to clarify.
Yeah, it will be a new IPA lah.
Yeah, so then it would be considered a new IPA.
Then in that case, then they have to go through the whole PDPP, including the onboarding, despite the fact that they have been here before, right?
Yeah, that's right.
Yeah, that's our understanding.
Okay. No, because it's important, because I have questions that people are asking that, hey, they are coming back, but maybe what if it's the same company that their work permit expired, they couldn't renew in time, and they applied a new IPA just for this person to come in? Would the same principle apply?
I think usually the same principle apply. And the reason is because MOF is our partner in this, and they really process thousands of applications, right? Both through the work pass general lane as well as this PDPP. I don't think they can make the distinction. So for example, there could be workers who used to work in Singapore 5 years ago, and then now they want to come back. And then again, they would have to apply for a new work permit and get the IPA and come in and be treated as a new worker. The other reason why, and I can understand this also, is that our system changes, our environment changes quite fast, and so even the onboarding program materials and the curriculum is updated very frequently. So someone who has gone through an onboarding program maybe a few years ago would potentially still benefit from that again, especially if it's an IPA.
Understand. So it's hard for MOF to differentiate as well. So I think the fundamental principle is clear, using IPA as the key reference point.
Yeah.
Understand. Thank you. There's this other question. Okay, this part I probably can answer. The statement made, S pass, E pass, and work pass existing holder can enter Singapore as per normal and not require entry approval as of 1st of April onwards. Is it correct? Actually, it's not, right? S pass, E pass can come in without entry approval already. But for work pass holder, there's nothing on 1st April that's any different. Work pass holder, existing work pass holder can return without going through PDPP, but entry approval is still needed as of 1st of May. Is that correct?
Yes, I believe so, but I will need to reference the guidelines as well.
No, actually, I think there was just give me 10 seconds. Let me just read. I just got an update from MOM and BCA. Yeah. So, Wilson and everyone, there was a transition period that we had announced in the middle of March.
That's right.
Following that transition period, and Gavin, we can confirm this, but I think there was a little update that from tonight, 2359 onwards, work permit holders, existing work permit holders, so not IPAs, existing work permit holders, don't need to have an entry approval also.
Okay. Now,
So this is also to help you out now.
Can I just jump in here? Can I just jump in here? There is an excuse me. There's an advisory that's sent by MOM, signed off by Ms. Liang Yahui, Director Operations for the ACE Group, that states the NXA states all the requirements in the table form regarding who is required to do PDPP and not required to do the PDPP. So I will encourage the members here to refer to the advisory. If I'm not wrong, the advisory was circulated on 25th of March. So if any of the members here still do not have that advisory, maybe we can suggest, maybe Wilson, can we collate them? Then we can ask MOM to send to them, or we send through SME.
I think Wilson, we just sent to you lah. Wilson, we just sent to you. You have us send to everyone.
All the participants are here, and then we have their database. We just will follow and send. We also send a circular as well, like the fee. So meaning to say the question, so there was a change. Essentially, as of 1st of April, even work pass holder, existing work pass holder, can come in without the need for entry approval.
Yes, that's correct.
That means technically they don't even need to go through PDPP though.
But they're returning,
right?
Yeah.
Yeah, these are returning workers.
So it will not be. There's no need to work to 1st of May already. Actually, 1st of April, that they could actually come in already.
For existing existing workers lah, not IPA lah.
Okay. No, because this is very helpful. I think this
is a good clarification, and I apologize that we were a bit tentative in our answer because the situation keeps on evolving, and then there were a few circulars updated over the weekend. But we do have a circular, as Kung Wei mentioned, as of a couple of days ago, and we will forward this again to Wilson for you to send to our counterparts.
Yeah, Wilson, I think this is the one I sent you a day or two ago.
That's right.
Yeah, that 25th March circular.
Then we'll just put it up and circulate again. I think this is helpful. So those who are here can actually have that clarification as well.
That's right.
Okay. So I just want to check anyone. So, but IPA, just to clarify, IPA will still need to go through PDPP no matter what. That it's ongoing, like essentially.
Yeah.
Yep.
Okay. Great. And I think just want to check anyone has any other questions regarding the PDPP. Here I have this lady named Nyanju mentioned that current work pass deployed overseas coming back. Okay, so we treat them as like a return worker lah. So it shouldn't be an issue.
If they have the same work pass lah. If they have the same work pass.
If they have the work pass and they come in, basically as of 1st of April, which is tomorrow, they can just buy any ticket because there's no VTL requirement just to fly back into Singapore. And they just can go back to their own dorm arrangement by their own employer, right? Okay, cool. So new S pass holder, it's still treated as a typical IPA like work pass holder, am I right?
New S pass holders?
Yeah, because new S pass holder also they'll be given IPA. Will they be given IPA?
But S pass and actually EP also, but S pass don't need to go through PDPP.
Okay, so no matter what, they have to go through the P. There's no need even to go. Okay, understand. Can. I think more or less the questions for PDPP is there. Just want to check anyone.
Yeah, PDPP to make it crystal clear is targeted only for work permit with IPA. That means new work permit holders.
And from India, Bangladesh, and Myanmar.
That's right.
So Malaysia is out of this this conversation itself, right?
Yeah.
Yep.
Malaysia will have its own process, I guess.
We'll go through the work pass generally now.
So everyone,
and they don't need onboarding if I'm not wrong.
Okay, cool. That's very helpful. Thank you so much again. I guess I don't see any others. And I just saw in the chat, there's this gentleman named Isaac. He has shared a screenshot. So if anyone wants to look at it, can also look at that as well. I think he shared a screenshot of the updated on-arrival boarding requirement in the CMP sector,
Ah, fantastic.
right? So here it shows that entry approved for MOM is still required for these workers, regardless
Yeah,
of
no,
the.
so this is IPA. So,
Mm,
so if let's say you are a work permit holder with an IPA, you still need entry approval.
okay, but
It
if
is
you
only it's only the returning workers.
okay, so it's to streamline it, so it's easier to understand rather than half. Okay, so
Yeah.
so
But
fundamentally, sorry, go ahead.
let's double confirm this, and then we get back to you.
Okay,
I
I have
think
this,
yeah,
I have this
it's
other
on the
question.
advisory. Yeah.
I have this another thing that popped up. This question, before 1st of April, MOM approved their worker, work permit holder worker, vaccinated to return from overseas leave to enter on April 15 with SHN. How should they then proceed when they come in? Because it's like now it's changed, right? So should they still go for their SHN when they come in?
When are they coming in again?
15th of April. But the
And sorry,
approval was given before 1st of April that they need to go, they were told to go to the SHN.
it's based on the time they come in.
So 15th of April when they come.
Yeah.
So in that case, when they come in, technically an employer can pick up the worker and then just bring them back to their own dorm without the SHN.
For returning workers.
Yeah, returning worker.
Yeah.
All right, great. Thanks for clarifying.
Yeah.
So I'm just going to check again. If anyone has no questions or anyone.
There was one more cost, Wilson. One more question, Wilson, on the cost of PDPP.
Is there a cost of PDP?
Yeah. I think it's just in the chat box.
Oh, okay. I may have missed it.
Yeah.
Okay.
Yeah, I think that to elaborate on the costs involved under PDPP.
Yeah.
Okay, so for the cost itself, maybe I'll just wait a little, then maybe both can add in. I think the cost itself, it varies. I think on BCA website, they listed quite a few vendors, also called service provider. So largely, SME is doing this as a service provider for our marine sector. And the price consists of the local SHN, the so-called the tests, the transport from the SHN to the airport, the flight, as well as the when you reach Singapore meet and greet to bring them to the MWOC. But again, there are some service provider that doesn't really cover that. For them, they just they cover just your accommodation and tests, and then after that, you arrange your own separate flight. And for some of them, there's a separate cost or admin cost when it comes to Singapore to pick up. So from my understanding from the BCA website, these are the range of different, there are different provider cover different part. But essentially, what the service provider should ideally cover here is the accommodation, the test, ideally to transport them to a chartered flight, and then having a chartered flight, and then locally to transport them to the MWOC. So that's at least for SME. So I just shared that. Anything else for Sean and Kevin you want to add in?
So I just want to say that SME has been really good at trying to reduce the cost as much as possible for everyone, and I think we from EDB's point of view, we really want to appreciate Wilson and the team's help to get the cost as down as possible. I must also credit Wilson because before PDPP we had a tighter regime and a more involved protocol, and Wilson has been working help all of you to get your workers in. We've seen emails and calls from Wilson at very late hours at night, on weekends and all that, so that every single worker that can possibly come in will come in. And I really want to thank Wilson for working in partnership with EDB to help you get your workers in as fast and as cost effective as possible.
Thank you so much for that. I think the team also helped, and also for you guys as well. I think you guys also clear weekend email as well. So thank you so much, EDB colleagues, for that.
Yeah, happy to help as much as we can.
Okay.
I must apologize because I have to jump to another call at 11:30.
Okay.
But please feel free to send any other questions on PDPP to Esme and the team, and we'll be happy to follow up thereafter.
Yeah, we'll follow up on that as well.
Yeah.
So any question, follow up by email. Thank you so much, Sean, for making time.
Thank you. And thanks, Kuwei, for reminding me that there was that circular a couple of days ago. So that one we will also send to Wilson, and then maybe we can trouble you to forward it again to all SME members, because that one we spent a lot of time scrubbing it to make sure that it was crystal clear. So hopefully that would be an easier way and an easier reference point.
Thank you.
Yeah, thanks everyone. It's a pleasure to be here.
Right. Thanks, Sean. I think Gavin, are you staying around or are you popping out also?
No, I can continue.
Okay, so just one thing that just came out, I just saw. So someone asked a question: must it be PCR test or must it be a PCR before coming in? But my understanding is either PCR or ART would suffice, right?
For the PDPP, is it?
Correct.
So for the PDPP, it can be either a PCR or a professionally administered ART.
So self-swab not allowed.
Yeah, you cannot self ART lah.
Yeah. So just for companies' knowledge, there is actually a list of service provider that's approved by our MOH. They have to go to them, and if they provide the ART, then they will do it, and should issue a certificate saying that you are cleared. So you need that document to come in, right? Just to clarify. So Gavin, we have the same understanding, right?
Yeah, that's right.
Okay, cool. Thank you so much. So I'm going to jump to Kunwei's side and team. So I think one of the first questions, I just want to might as well say it upfront, is a lot of people asking about a staggered rest day. So I just want to get it out of the way. So staggered rest day, as far as we know at this point, it is still status quo. However, and it has to wait for MOM to come back, essentially. So there's no change to staggered rest day, even though, just to again credit your end, you guys have been also working and checking with MOM whether it can be going back to status quo. But this is a call to be made by MOM, right? Yep. Okay, so I just thought I'd get that out of the way because I do see a few questions popping out the same ones. Okay, so the first question here is: do companies need to ensure the visitors' vaccination status when they come in as part of the SMM?
Okay, yes. The key thing is that if they're coming for business, visitors the site occupier and premise owners need to check. But of course, if they are coming not for business purpose, if I'm not wrong, in the MOM, it states that if they're just visiting, right, and they're not working, then there is no need to check for the vaccination status.
Okay.
But I will just encourage the companies because right now it's very difficult to when any of the inspectors come down, right? It's very difficult to note whether the person is vaccinated or not vaccinated, especially the visiting. So I just want to stress that in WSH or the Workplace Safety and Health Act, the COVID safe workplace regulation states that an unvaccinated worker is only allowed to work in the place of residence, nowhere else.
If unvaccinated,
Unvaccinated. So the person cannot even be a driver, driving and not entering the work site, for example, because there's no contact, right?
Yep.
Yeah. So the unvaccinated worker can go out, but just cannot work. Yeah.
Okay, understand. Thank you. This other question came in saying that, is there any change to the guideline regarding performing the pre-departure test at the last port of pre-departure and the submission to MPA for approval of vessel to dock?
So Wishin, can you just maybe show the sector-specific SMM, please? Okay,
Yeah,
so generally what we are saying now, the mandatory precautionary measures, okay, so pre-departure tests and on-arrival tests are still required for contact operations.
Okay.
Which means there's a physical interaction between shore-based personnel and the crew. So the duration is of travel history monitoring is been reduced to 7 days, and therefore that's the thing that PDT is required. One good thing is that it is now professionally administered. ART is required, is accepted. And so that's something which we just want to share with your contact operations, MPM. Yeah. Okay. So that's something which just need to note now. Okay. And thereafter, which in terms of on arrival tests, which is day 1 PCR, then day 2 to 7 ART supervised by the shipmaster or ship agent. are the required ones that needs to be adhered to. Yeah.
Okay.
Mm.
Thank you. All right. There's
But
this,
I just want to inform the
yeah.
members that we are still reviewing this with MOH as we progressively open up. Because now there's a relaxed SMM at this point in time. We are still reviewing at MOH whether can we reduce the amount of testing or even the PDT requirement as it is. So please wait for the updated advisories or measures that will be circulated that we will inform to you through SME. And then just keep in mind that we are always in review with the MOH.
Right. Cool. Thank you. I have this question that comes in. I think there's a few anonymous people asking the same thing.
Yeah.
Is an open workshop with a shed considered indoor? And what's the requirement for such area?
Okay. Wishin, can you share the MOM website, please?
Yep. Okay.
Okay, so MOM website, right?
No
we
moment.
take it that
it's not shown yet. It's not
it's
shown.
loading first, yeah. But
okay.
what we're trying to say is that MOM the requirements will be the mandatory we need to adhere to, because that is the one that is published, and of course whatever they publish in the AGC stature for the workplace safety and health COVID-19 safe workplace regulations would be the guiding principle that the employers need to know quite specifically what to look out for lah. So maybe we just run through quickly again. Let's go to the mask one. I think it's 8A or 8B. 8 clause 8A or 8B. Yeah. Okay. So 8A, wear mask when indoor, except during activities that require mask to be removed, right? Then there is a footnote number 5 down there. You all see the footnote number 5 down there, right? So you go all the way down to footnote number 5. It states, the requirements for masks to be worn can be waived when carrying out in the course of employment, in an activity that requires no mask may be worn or that it must be removed for the equipment to be worn, other equipment to be worn, PPE to be worn. So when, what does it mean? If the activity in the course of employment doesn't need the mask to be worn, then need not to be worn. Okay, so that is where the footnote number 5 states here. So we go back to 8A again. So 8A is when wear mask only when indoors, right? So that's something where some companies, I would put it maybe in a layman's term, which some of you may disagree, some of you may find it ridiculous, but I just want to just make it very simple for people to understand. If we look up straight up to the sky and you cannot see any roof, then that is considered outdoors. If you look up and you can see a roof, then it is something where it can be considered as indoors. However, technically, the concern then comes if we look at the one of the clause which says about ventilation. As long as the place is well ventilated, because right now MOH has also stated like the footpath along the outside of the provision shops or those HDB shops is also considered outdoor because it's well ventilated. But if we have difficulty in defining what's indoor and outdoor, then that's something where I will just use that simple analogy or guiding principle. You look up, you don't see any roof, you can consider it as outdoors. But of course, there are certain places where it is very tight space and you can see sky one, but the workers working side by side is very close to each other. Just take note that if the workers are wearing masks, there is actually no strict safe distancing to be monitored. That's why they said that in mask off settings, there's still a need to have 1 meter between groups of 10 at this point in time. When mask is on, there's no safe distancing, because ultimately what we are trying to do is to reduce or minimize workplace transmission. And as what Sean has said earlier, we are almost there, but not totally out of the woods. COVID is still an infectious disease. It is still required under the Infectious Disease Act or the COVID Temporary Measures Act to take public health actions when necessary or when appropriate. So so I will urge the members here to exercise a bit of still exercise a bit of precautionary posture, but right now just adhere what is listed down in the MOM website. Okay. So to the question about the big hangar, 10, 20 meters headroom type for the shed, right? In my opinion, I would assess that as well ventilated, and hence therefore no is considered similar like those bus stop, for example, which is also no need to wear mask type. I mean the above ground bus stop. Okay, so I hope that answers the question. But certain companies have already defined what is indoor and outdoors, and each site occupier and premise owners can do that definition under your own discretion. So I would urge that maybe the site occupiers and premise owners do help to provide the guidance to your contractors when they're coming into your site. Yeah.
All right, thank you so much, Kunwe. I think your time taken to explain the principles behind the concept, I think that's very helpful. So hopefully that gives some idea to members who are listening, a grasp of how do we define what is outdoor and what's considered indoor. Okay,
Yep.
so going to the next one, there's this question that mentioned similarly, I think under the similar track is there a need to still maintain a nominal role which maps out the different AG or C plus incident since there's no split team? Do you still need to maintain it? And
Okay.
also, yeah, sorry, you go ahead first.
Sorry, Wei-Shin, can you just share the MOM website again, please? Okay, so you see that we are drawing very much back to the MOM website. And Wilson, I think that's what you are trying to continue from that nominal role is beyond what other things they need to do when there's an incident management, right?
Yep.
Okay. So in clause 15, it states that employers are still encouraged to take the following steps in 15A, 15B, 15C, and 15D. Encourage. It is also announced in the multi-ministry task force press conference that because COVID is still an infectious disease, right? We must be prepared to re-establish appropriate healthcare protocols should situation worsen. Hence, because this 15A, B, C, D are still encouraged, which means ultimately companies, when our inspectors go down, for example, because it's encouraged, we won't be asking for all this information. And hence, when Wei-Shin was sharing the incident response and management plan, if you notice the process flow, within 6 hours do what, 24 hours do what, 30 days do what, all these things we recommend companies to continue implementing it as best practices, such a way that until the point where you are comfortable that we do not. Okay, ultimately, what we are trying to do is to prevent any more business disruption. So companies right now can exercise your discretion to reduce any more sort of rather widespread transmission, because ultimately MOH is still concerned if there's a large cluster formed, which is 40 AG plus over the last 3 consecutive days. Okay. If we go back to the RAM, the risk assessment matrix, which is the second last slide, the RAM is, to recap again, these are parameters that the companies can use to assess what's the risk level of transmission that your current operation is operating in. And if you feel that there is it presents a very high risk, then it's as part of the, similarly like risk control, right? We can always do what are the risk mitigation measures. Example would be to reduce the cohort size. Whether you need to reduce cohort size, if we look at the MOM website again, it only states that it's only for mask off settings, which is the prevailing group size is 10. But if it's mask on, that theoretically there is no group size restriction, right? However, this is something where, as I mentioned, because if there is the situation worsen, especially marine sector, if you're interacting with NTL, the not to land crew, we do not know whether subsequently there's a new variant of concern, and these NTL crew members are the ones that are exposed to multiple countries. Of course, by then, we will have been triggered whether some of these countries are going to be considered as countries of concern. Yeah, I hope that answers the question.
No, that's helpful. Thank you so
Yeah.
much for. So I thought I saw a question, then it disappeared. Sorry. I was also trying to look for the questions that I wanted to pick up. Okay, never mind. I'll just come and try to look for it again. So okay, someone was saying that with latest Port Marine Circular, the 105 of 2022, are they expecting the same updates from EDB managed premises?
Okay, sorry, I just need to see what's the PMC 105 of 2022, because I know
Yeah.
they issued something yesterday, right?
29 March, yeah.
Yeah, I think it's the one that, if I'm not wrong, sorry, my apologies. Yeah, just give me a moment.
So that way I can still look for the. So there's this other question, Miss. So I'm just gonna try to ask for you. Search is everyone entering the shipyard have to do safe entry. Then is there still a need to have safe entry into an event hall within the company?
Okay, so they only stipulate entry requirements into the premise. If we go into let's say for example a shopping mall right now, right? Shopping mall only entry they check, but if you go to the shops now, they don't actually ask you to tap for check-in at this point in time. Yeah, so we adopt the same principle lah.
Okay, but some shops still have so but now actually there's no requirement. If once you enter the mall, it's treated as a whole.
Yeah. Actually, because the whole mall is considered one where only vaccinated personnel can go in. So if they are allowed to go in already, then there really is no need to check whether they are vaccinated or not.
So just to jump on that, there was a question I asked: if an unvaccinated person just visiting the shipyard for a meeting, are they allowed to come in?
Meeting is business activity.
So it's considered they can come in.
So they can't.
Oh,
they can't.
Sorry, not allowed to come in.
Yeah.
Casual also cannot, right?
Casual, as I mentioned, right? So then if the inspectors happen to be there, the companies will have to justify, or rather to state why is this person visiting lah. Yeah. You know what I mean? So the companies must be prepared to answer lah, because like for example, up to 75%, right? Those workers who can work from home, only up to 75% can return to site. The inspectors that comes in, they will just ask your total facility, say got 100 people, and just how does the company ensure there's only 75% is that can work from home is back to site. They don't ask for like nominal role or things like that really at this point in time. Okay. So that I hope that answers that question.
Okay, are you still looking for the circular?
I have the 05 2022 with me. The question was specific to
whether or not EDB will also issue similar updates for EDP managed premises.
Let me just check. If I'm not wrong, the contactless operations are largely the same, which is Annex A. Annex B is largely the same. I think they okay, never mind. What I'll do is that I will review that. Whatever it is, what the Wei-Shin has presented in terms of the mandatory precautionary measures and the contactless operations will be published in the MTI COVID Go Business website for sector-specific requirements.
Yeah, I think we can also share, SB will just also share the link as well after this as well.
Yeah.
Okay, there's this one thing that popped up. I found it,
Yes.
which was quite interesting. I didn't spot it, but someone indicated saying that the risk assessment matrix still indicate RRT compliance rate. Is there still?
Oh, yeah. My apologies. We should have removed that. That's a very very keen eye on the members. Yes, we should have removed that RRT. Okay. Okay. What I mean by that, not to backtrack. but certain companies, they still require, for example, pre-entry tests. That is under their own discretion. Okay. Some companies may, because they are critical, right? They may still want to, because remember, even though RRT is removed, was it 14 or a previous press release, they still encourage people to do regular testing. So if the company does some form of regular testing, that it helps. But because the Omicron, the incubation period is up to 2 or 3 days. It's only 3 days. The Delta wave is about 3 to 4 days. So therefore, our previous marine sector where we're doing 3-day FET RRT is not really effective because the person could have been infected already, and by the time he does the next test, it could be the viral load will really come down already. So that's why we totally remove the 3-day FET RRT. But if we really want to pick up whether a person is infected with Omicron, it's almost every single day need to test or every other day. Yeah.
Understand. I think and the ART cannot differentiate whether it's a person shredding or not as well, right?
Cannot, because unless we go for PCR, then after that there's a cycle threshold, which is a CT value, then they start to run through the thing again. Yeah, which I don't think any company want to pay for PCR right now. Yeah,
the investment is not worth it. Okay,
yeah,
so
the ART is only $5, you know.
Right, I saw this question and came out saying that migrant workers who were infected with COVID, do they still need to adhere to EDB, SMM, like mapping and work zone? Because this is not required by MOM. When apparently when they reported, this is not required by MOM.
Okay. We indicated, or Wei-Shin has indicated, that the instant response management plan that was circulated in the past, we have really moved that into the best practice. So companies, best practice means not mandatory, right? But if you refer back to the MOM website, it's also encouraged, which is clause number 15, if I'm not wrong. 15A states, or rather 15 states, steps to be taken by employers should any of the workers be infected, is that employers are encouraged to take the following steps. So step A is to establish colleagues who have interacted with the infected worker, which is contact tracing. Okay, but you will note the example are meals together with the colleagues. Hence, the focus area are during mask off situations, which is makan, smoking, resting areas. The part B, 15B, then is whether the company want to do any form of testing if they are not issued with HRN. These days, in the past rather, HRW, which is the previous health risk warning, are already not issued to workers if they are at the work site, for example. So HRN or HRW are only issued to fellow housemates because they are in household settings. So therefore, in my opinion, it's a good practice to test because what we are trying to prevent, right, is more people get infected, and then that will disrupt your business. So ultimate aim is to reduce as far as possible more people be infected, and so as to not to have a business disruption, because we all worry about Omicron, right? In the February period, a lot of people infected. Some of us can't even allow 3 days of isolation for these workers, which is protocol 2, before they come back on the day 4 or day 5. So this is something which we are just trying to share with you, that the IRMP, the Incident Response and Management Plan are best practice, and in the past, it does help to reduce worksite transmission. So whether you map or not or work zone, this is under your own company's discretion. To us, it helps to that at least you see the heat map where are the infections are popping up and then you can assess for yourself whether is there something to be done for that particular work zone or not, or for the particular cohort. Because ultimately in 15D, it states that you need to, companies are encouraged to review the implementation, the system of the SMM. And so whether is there maybe temporary measures, is that even outdoors need to wear masks for temporary or few days, to try to reduce the number of infection across the cohort. Yeah.
Cool. Thank you so much for that.
Yeah. So sorry. So come back to the point of recovered workers, right? End of the day, recovered workers, the only part about recovered workers is their exemption from HRN, for example. So whether whether they are of concern or not, to us, the exemption period is up to 180 days, right? So after 180 days, so then the question then comes is that if your companies know the recovered status as to how many days have been recovered or not, then that's something where it'll be good, because the companies have a good records keeping of your workforce, not say demographics, but infection status, and of course vaccination status. Therefore, that's why we actually encourage our companies to register for the Sync app, which is SYNC app, that allows your workers to share their vaccination status plus the swab results if they have done any. Because currently some of the guys, some of the workers do go to clinics to do their PCR test if they are symptomatic, or even ART if the GP requires them to do if they are displaying ARI symptoms. So with that, at least the individual is able to share their status, and that Sync app actually generates a daily report on the following day, 8 to 9 a.m. for the past days, record of their workers' vaccination status, PCR test, and an ART test. Because your vaccination status, some of your workers in the past are recovered, right? After 270 days, or rather if they have been fully vaccinated in the past before they're infected, then no more booster to be taken. But if they only have one shot of the mRNA dose and they're infected, after 90 days from the point of infection, it is actually required for the worker to complete their vaccination. And this is when their vaccination status will turn, whether is it fully vaccinated or not. So for SCPR, have to look at the health hub. But for the migrant worker, it will be looking at the access code. So therefore, the Sync will actually help the company to have that vaccination status report, and that will help them to track sort of automatically without the need to track every single day.
Something that comes to mind on this. So I have this case that came up before. So what if a worker who is recovered is still within 180 days? He left Singapore, and then he's supposed to come back in, but he is already busted 180 days. Will he be treated as vaccinated or non-vaccinated?
Unvaccinated.
Even though they did the vaccination here in Singapore, and because it's the 180 days, and they went back to their own country, and so that means before they come back, they have to take a second vaccination dose in that country.
A fully vaccinated status is 2 doses of mRNA. And if they have registered the vaccination in the National Immunization Registry of Singapore, then all is fine. But if they are in the MOH records, they only have 1 dose, then this person is considered as unvaccinated or partially vaccinated. Yeah. Then the following treatment or for partial, non-fully vaccinated or partial fully vaccinated will come in, and that is where the Gavin just now the PDPP flow will kick in. Yeah.
Okay. So I see this question here says, this I'm not too sure, but it says for vessel departing from shipyard to Anchorage and sea trial, how is the PDT or pre-departure testing for the personnel on board going to take place for vessel returning back?
Okay, with regards to that, MPA is the subject matter expert for sea trials. We are I think MPA is right now reviewing with among that we are going to have a meeting with them to clarify on the sea trials requirement. And then when it's finalized, MPA should together with us we will review, or we will just update the members for sea trial matters, because we understand the ones that are of concern, SCPR long-term pass holders, they don't need re-entry approval, so they can just come in. It is the work permit holders that long-term pass holders includes, because entry approval at that time is required for CMP workers. Okay, so CMP workers, if they are coming back after a sea trial, whether are they allowed to disembark or re-enter Singapore without entry approval. So these are something which we are trying to align with MPA and ICA, because ICA is still managing the borders, and they will be the one chopping the passport to allow them to come back in. We should come back to the members pretty soon.
Okay, right.
Okay.
So I'm very mindful about the time. It's already 12 o'clock, and then we also put this up to 12. So maybe after this, we will collate more questions. So members or attendees, the Slido link, just put it in, key in the question. So the association, the secretariat will consolidate, we'll send to the agency, and then from there we have a collated response and send it back to everyone. In addition, I think two more things. One is regarding the slides. I think we'll share the slides as well. And the next thing is I see the same question popping up again about staggered rest day. So to clarify, staggered rest day is still status quo. It is still supposed to be staggered, but MOM is updating and they'll come back to you. So we are trying to ask for that as well. So I think that's pretty much it. Any last words from you, Pune?
Nope. I just want to thank everybody's patience. We are members' patience in accommodating, not accommodating, but being supportive and responsive to our efforts, joint efforts in trying to keep our work site safe. We are almost there. Just want to encourage our members here to still remain vigilant, even though COVID is. Right now our cases count is coming down. It's just that some of it, every individuals will react to the COVID infection differently. So some will have a long COVID symptoms, which is now quite prevalent for those who are recovered. But however, it is also stated that for those certain people will still suffer quite severe ailments or repercussions from being infected. So what we try to do is that try to reduce, minimize, or rather reduce business disruption where possible. And our best practice in the past, you can look at it and see, just implement whichever is appropriate for your companies. Okay, yeah, that's about it.
Thank you.
Thank you so much, Kume, and also to Wilson. So before we end the webinar, I would like to bring everyone's attention. So due to workplace accidents that have actually taken place recently, this is of grave concern for our industry and also the association. So as such, all companies are actually strongly encouraged to conduct a safety timeout exercise to review their work activities and protocols, as well as those undertaken by their contractors and subcontractors. So employers should take this opportunity to assess and review safety provisions and implement immediate necessary measures to uphold good safety protocols.
Yep.
Workers should be briefed and trained appropriately to ensure that they understand their work and how it should be performed safely. So we would appreciate everyone if you could make time to conduct this STO no later than 14th of April 2022 for the benefit and welfare of your employees. So kindly indicate your scheduled date for conducting the STO via our online form, either by clicking on the link that I think my colleague will send shortly in the chat box, or you actually can scan the QR code as shown on the screen. So this should be done by 1st of April 2022 for the STO, and we'll then collate the responses and update the Workplace Safety and Health Council and also other stakeholders. So maybe just give a couple of seconds for everyone to just click on the link or scan the QR code for this. Don't worry, we'll also be posting it on SME's Facebook and LinkedIn page, so you can also refer to that later on in the day.
Maybe
So
just
we
to
have come to the end. Sorry,
No, sorry.
was
Remember
it?
just to in a little bit. So I think, not sure if companies or members are aware. I think over the past 2 weeks, there's been 3 deaths that has happened in our marine sector. So I think that's the same amount as 2021. The whole year you have 1 fatality. 2020 has 2. So already in the first quarter, or in fact in 2 weeks, we have 3 fatalities. So this is something that is of, like mentioned, great concern. We do hope you guys take the opportunity to review. I think business are coming back, people are stepping up, but also I think safe lives and livelihood are equally important. So as what Amanda mentioned earlier, let us know by tomorrow so that we can at least collate, but you don't have to do by tomorrow. Just do it within the next 2 weeks. Let us know roughly when you'll be doing it. That'll be very helpful for us to collate. Yep. Thanks, Amanda.
Thank you, Wilson. Yep, so we have come to the end of the webinar. So should you have any questions, you can actually drop us an email or the CCO team an email at these email addresses. So it will be admin@asmi.com or cco@edb.gov.sg. Thank you so much, and we hope you have a better understanding. Stay safe and have a great week ahead. Goodbye, everyone.